Speaker. We have the next speaker, Dr. Sujata Das. May we have the introduction, please, Dr. Sujata Das.
Dr. SUJATA had her MBBS and MD from MKCG Medical College, Berhampur. She had her training from L.V. Prasad Eye Institute and from Australia. Then she is now heading the cornea department of L.V. Prasad Eye Institute, Bhubaneswar. Sujata, please.
Good morning. So I'll be talking about the institutional practice, how it is safe and peaceful. So I'm not going into detail of private practice. We've heard about private practice, we've heard about group practice. So I'll say what are the advantages. There are, everything has its own advantage and disadvantages. And basically it depends on what you want in your life. Already the first speaker, I think, has described what you want. So in the working environment in an institutional practice, is you work for patient, but you are same time you're a hospital employee, but you don't have additional responsibility like financial, more planning and all. So the number one advantage is sharing responsibility. So there are different people for different jobs. Like a private practitioner, you have to put your head in everything, but here the different department like receptionist take care of check-in and check-out, surgical counseling are done by surgical counselor, medical tests are done by lab technician, and cleaning and security are taken by support staff. So coming to number two advantage, as a private practitioner, you may earn more, but in institute practice, you have a salary and you have a steady income. Like for example, COVID again has taught us in private practice, it may hit badly, but in institute, most of us can sustain per few months or year. Though there are added benefits and increment. Especially this third advantage is applied in ophthalmology because you have all money, everything is expensive and every year it keeps on changing. So it's a heavy branch. Whenever people do PG, now that is, they calculate whether to go to ophthalmology or not. And a single person is difficult to take the cost of burden. In institute, mostly it is done by the management team. Again, latest technology is not only to acquire a machine, you need to upgrade also every year or every 2-3 years. So in an institute, it can be easily done. So as a teamwork, and this is the biggest advantage compared to other places, I'll say. In solo practice, group practice, there are people who practices even private practice, but the environment in institute is for research and publication. I'll say this is the biggest advantage in institute practice. If you want to career in publication research, the institute is the best. So in one setup, is even if it is cornea, retina, glaucoma, in one place, everything can be taken care. So basically, you can do a subspecialty practice rather than a comprehensive practice. And continued career growth. In a solo practice, you may earn a lot with experience or with a year passing on, but here is a career growth. You may join as a junior consultant, but at one point of time, even the head of institute. Even people have joined as a DNB and they become the head of the institute in our system. And because you have trainees all the time, DNB fellows, you learn every day because you have classes for them, you learn as well as you train them. So this is the excellent opportunity to be up to date. And funds for emergency situation, like for example, COVID, there are a lot of research funds which private practitioner may not get, but you may get as an institute person. There's a legal issue. The institute takes care of that, not as an individual, you have to take care of all this litigation. And amenities like you meet people and you have cafeteria, even in small group practice it can have. But this is the place where you meet people, you share your ideas, and the research ideas come from this. And you build new relation with the other hospital. Sometimes if it is only ophthalmology hospital, you build relation with medicine or rheumatologist. When you do some patient or patients, and you send patient to them, or in research, you do new relations. Thank you.
Thank you, Dr. Sujata. I'm sure you must have lured a lot of youngsters to join an institutional practice by your talk. Just to summarize what you said, the institutional practice gives you or makes you learn teamwork, good quality patient care, exposure to a lot of latest technology, no significant administrative or financial responsibilities, steady income, satisfaction of training the youngsters, and of course research and publication. Thank you.